our next exhibit hall interview, where I am going to be speaking to one of your favorite glaucoma experts, Dr. Justin Schweitzer. Today, we're going to be discussing Heru, which is an innovative company that's developed wearable technology. Welcome, Justin. And for those of you who don't know who Justin is, can you just provide a quick background about yourself and your practice?
You bet. Hey, Stephanie, excited to be here. Thanks for spending some time with me and the opportunity to chat a little bit about Heru with you. You know, I practice in an ODMD practice in Sioux Falls, South Dakota called Vance Thompson Vision. I've been there for about 10 years now, and I work alongside a glaucoma trained specialist, and he's anterior segment trained as well. We see glaucoma, cataract, cornea, really anything on the front of the eye. We do a lot of MIGS procedures. Say about 50 to 60% of my day is managing glaucoma, and the rest of it is anterior segment disease. And so excited to talk a little bit with you about some wearable technology.
Awesome. Well, welcome. And it is so cool to have you as an expert, not only in glaucoma, but I know you also specialize in the front of the eye. You kind of are from anterior all the way posterior. So you're a true expert in the entire eyeball. So this is really, really exciting because visual fields and some of these wearable devices are even more innovative, than just traditional eye care. So it's so exciting to talk about this with you. And can you just kind of let us know how wearable devices, how is that something that has been necessary, or there's been some sort of a need in the eye care community that you kind of recognized as, oh, this is something really interesting?
It's a great question. You know, when you think about any of us that manage and treat glaucoma, it can be hard sometimes to kind of go in a different direction. We're so used to our standard automated perimetry. We know how to read that. We know how it works. And that's really what we grew up on. And then something like this comes along, a brand new technology, and you kind of have to wrap your mind around it. But once you do it, and a lot of the things we're going to talk about, you're going to see there's so many advantages to it. I think, one thing it does is it really gets colleagues that are interested in treating and managing glaucoma that maybe don't have the ability to invest in a technology that's going to cost them, tens of thousands of dollars to get a visual field, to get one at a nice price point. And by the way, as we talk about it here in a little bit, that matches up fairly well and very well to our standard automated perimetry. And so I think it helps to kind of expand optometry's reach in managing patients with glaucoma, because we have access to something like what we're going to talk about here, which is this Heru virtual reality wearable headset. I think the other piece to it is it eliminates bottlenecks. It eliminates issues in people's clinics. So someone like me who treats a lot of glaucoma on a daily basis, we have a few visual field machines in our practice, but that is the biggest bottleneck we run into. It gets backed up. My technicians complain to me about it. They need something to be more efficient. And this has allowed an opportunity to be more efficient in the clinic, because patients could sit in the exam room and do this. They could sit in a pre-testing room and do this. They can, sit in their vehicle if they wanted to do this. The point is, you don't have to have a specific spot for it in your clinic. So I think number one, it expands our colleagues' ability to manage glaucoma. I think it increases efficiencies in our clinics and increases workflow. It helps with workflow issues.
Yeah. And can you just kind of explain to us what this device is? Is it something that you're like a helmet they put on? Is it something they just put on their eyes? And then what are the patients experiencing?
Yes. So if you get a chance, please go to the Heru booth. You're going to have an opportunity to see the device and some images. And it really isn't a big helmet. It just really is a simple, easy device that looks like a pair of glasses. It's a little larger than a pair of glasses, but it kind of wraps around your head very comfortably. I have patients tell me that it's extremely comfortable. That's why they could sit in an exam chair. They could sit in a pre-testing room and they don't really have to think about it. It's easy for technicians to use. Patients are given instructions on how to utilize it. There's audio, so there's verbal cues to patients. You have a technician there that can help guide them, but just such a simple technology to use and a comfortable technology to use. And you're not having to deal with lighting conditions. Again, it doesn't matter. You don't have to turn the lights down when you're utilizing this technology. It can be done in any type of lighting condition. And again, take a chance to go look at it at the Heru booth. I think you'll be impressed just with the footprint of it and the size of it. You're not taking up a big area in your exam lane. Again, it's smaller than essentially when we think about a BIO, smaller around that particular size.
Well, I'm really glad you brought that up because I feel like that is what inhibits a lot of practitioners from purchasing equipment. Half the time it's, where am I going to put this thing? And like you said, it has a very small footprint. And also, how am I going to integrate this into the flow of my clinic? So can you kind of explain, like, maybe how a regular visual field machine, how is that different than something like this as far as patient flow?
I think it depends on your clinic a bit. I'll give you an example. In our clinic, we have 3 visual field machines, and they're in specific rooms and they take up some area. And I love my visual fields. I look at this as an adjunct to those visual fields. I don't think we'll ever stop using those. But the beauty of this is when a technician tells me, hey, we're backed up 2-3 patients or even a patient, I won't hesitate to utilize a technology like this. The printout is interpreted the same way that you interpret a printout from previous visual fields that we taught on. So there's no, learning curve as a practitioner in trying to figure out, how do I interpret this particular visual field? We can leave the patient in the room. So technician will go in there, we'll set the patient up, they'll take the test. The patient can even, or the technician can even leave if they want to while they're taking the test. The problem is it goes so quickly. A lot of times with this particular technology, it's fast, 3.5 minutes, a lot of times, maybe 4 minutes to take a test. So there's not an extended period of time that patients are undergoing this. And so that's how I look at it in my particular practice as an adjunct. But I will say, when you think of other colleagues that are maybe not seeing as much glaucoma as I am, but want to see glaucoma or are interested in seeing glaucoma or are seeing glaucoma, but just don't initially have the funds to maybe invest in your standard automated perimetry, what a great option for you to be involved in taking care of glaucoma patients, because you could even have a couple of these devices and run patients through this. And again, there's no learning curve to identifying defects on there, and you can manage patients at a high level.
Well, I'm really glad you brought up the timing component, because I know for me, that is always so frustrating for the staff. Is they're like, oh my gosh, I have to, first of all, take the patient from the waiting room all the way into the special testing room, which is, for why do we put it at the back of the clinic? I don't know, but a lot of us do. And so the patient's going all the way back there. Plus you have to close the door, turn off the lights, make sure all the settings are correct, like you said. Then the technician is going to be in there for however long, and then if the results aren't reliable, they have to repeat the test. And then, the patient's like wiped out by the time their visual field is done. So I'm really, really glad that you brought up as far as the timing component, because that's improves efficiency probably tremendously within the office. And I know that this is a question that a lot of doctors have, is how does the Heru platform compare to the HFA, and how does it differ?
Yeah, really, really good question. I think a couple things. You get 4 tests with it. I should, mention that. You get 2 screening tests. So if you want to use it as a screening visual field, you definitely can do that. It can test the eyes in 45 seconds or so as a screening test. And then you have the ability to convert that, if it picks something up, to a 24-2 threshold test. And you can order a 24-2 threshold test. You also can order a 10-2 threshold test. And so you have a variety of different fields that we utilize on a daily basis with our glaucoma patients. There's also a prospective study that was done looking at 80 some eyes, where they took about 50% healthy eyes, about 50% glaucomatous eyes, compared the Heru visual field versus our standard automated perimetry visual field. And essentially they were the same. They performed very similarly to one another when you look at the comparison of them, when you look at the correlation of them. And so that makes us all feel really good about utilizing this in clinical practice as well. I think the other thing is the speed of it. I mentioned it. A lot of times if you do a threshold test, it's going to only take about 4 minutes. So I would argue, and there's no hard data on this, but I would argue, being that it's such a short test, that it's going to be very accurate. And once we see more data on, that's exciting, because the accuracy is such a key piece with visual fields. If a patient's taken a 15-minute see to standard visual field in one eye, you can't tell me that's going to be a very accurate visual field. Faster is better, because patients will be more accurate in that regard. The other thing is the comfort. Patients are comfortable with this technology because they can, like I said earlier, sit in an exam chair. They can sit at a desk. They can sit in a pre-testing room. They can sit in their car if they wanted to as well. And then the last piece of it is, it's very easy for patients to understand it, the instructions around it. There's that audible piece that they're telling them how to do it. And so All those things probably differentiated a bit from our standard automated perimeter. And again, I look at it in my practice specifically as an adjunct, but I think it definitely could be standalone in some of our colleagues' practices just based on what types of glaucoma they're seeing and how much glaucoma they're seeing.
Yeah, and I'm so glad that you brought up the patient experience, because I know a lot of doctors, they want to know what is going on through the patient's mind, kind of what is it like for them. So besides kind of being remote as far as they can take it in the waiting room, maybe the dilation room, maybe the exam room, their car, wherever, because it's mobile. What else can you tell us about the patient's experience and who the ideal candidate would be for this type of technology?
Well, it's really ideal for any type of patient you need a visual field for. So it can be ocular hypertensive, glaucoma suspect. You can use it as a screener. You can use it on your glaucoma patients as well. Patients typically comment on the comfort of it. It's not uncomfortable to have it on. I think that's a big piece. I come from a practice, and I know you do too, Stephanie, that customer service and the customer experience is huge. Having that kind of wow factor is a big deal. And when you have technology like this in your practice, patients comment on it. They're interested in it. And so I think it is a good practice builder as well. But I mentioned the study earlier that you can feel confident in utilizing it. I mentioned the comfort of it, the speed of it. So there's a ton of advantages, and patients notice those things and they comment on those things to you as well.
Amazing. Yeah. And I think that as a physician, that's something really important, is what's going on with our patients, because even if there's some sort of technology that's amazing, if they are having a really hard time with it, or the staff absolutely has a hard time with it, or like you mentioned, there's some sort of learning curve for the doctor to be able to understand the results, those are all kind of barriers to entry. So it sounds like with this technology, it really has made it streamlined for kind of the whole practice, which I think is awesome. Do you think that this wearable technology is going to expand NOD's practice scope?
It's a really good question. We kind of talked about it a little bit at the beginning, that I do think it will allow practitioners that, understand glaucoma, especially, let's say, new practitioners where you and I know it's not easy to come out of school and all of a sudden buy every technology that's out there. You want to manage glaucoma, but it's hard to buy an OCT. It's hard to buy a pachymeter. It's hard to buy corneal hysteresis. It's hard to buy a visual field, all these things, and start to treat glaucoma. And, when I talk about glaucoma and educate on glaucoma, I always talk about it's a big puzzle, and you got to look at all the different pieces to the puzzle. Well, I'm sure there's practitioners sitting in the audience and say, well, how do I get all the pieces to the puzzle? Because it could be expensive to have it all. So I do think this type of technology is going to allow practitioners that don't want to spend all that money maybe on that standard automated perimeter, that legacy device that's been around for a long time. And they're going to have the ability to get a really good wearable visual field. They may be able to utilize a couple of these and still be able to manage and treat glaucoma on a daily basis. And then on top of it, they get a few other additions with the Heru platform. They get dark adaptation with this. They get contrast sensitivity with this, and they get color vision as well. So not only are you getting the 2 screening visual fields, the 10-2, the 24-2, but you're getting those other 3 additional tests. And by the way, you could still bill for these things. I mean, we want to get paid for it, and you're able to bill for these types of technologies because they're CPT codes that are formulated around them.
That's great to know that there's other things that can be done, not just visual fields. It's kind of cool that it can do some of these other things. So I guess I'm sure there's people that have heard about other wearable diagnostics, and I'm sure you've, being such an expert in the field, have tried so many different devices. Can you kind of explain how this one is different from maybe some of the other ones that are on the market, or are they all the same? What kind of makes them similar or different?
Yeah, no, it's a great question. There are a lot of them out there and on the market, and I think they all have their positives. I would say this particular one with Heru, the footprint of it is just such a small footprint. It's not going to take up a lot of space. Like I said earlier, it really looks like a small BIO, and we're all used to that. So that's one thing. The patient comfort thing is a huge thing as well. And I've had a chance to utilize a few of the other types out there, and patients love the comfort of this. And again, go to their booth and get a chance to take a peek at it. And if at some point you're at any type of live meeting, they're always around, get a chance to put one on. It's extremely comfortable in the way that it works. And then the platform is very easy to use, not only from a technician standpoint, the technicians love it, but the patient standpoint. The patients are going to comment how easy it was for them to utilize it as well, because the instructions are easy, the audible piece of it, guiding them through it, and then the short test time. And so it really has a lot of advantages, and those are just a few of them.
Awesome. And last question, since you have so much familiarity with Heru and the device, can you kind of just walk us through how you've implemented it into your practice? Maybe kind of guide us through like the typical use during a day. Like you said, maybe you'll have somebody doing that because it's getting bottlenecked somewhere else. And it's like, okay, let's just do this visual field in this exam room real quick. Can you kind of guide us through kind of how you're using it in your own practice?
So, we've had the opportunity to utilize it with some research projects. And so we're utilizing it right now, doing some research around, comparison to different visual fields, comparison, in more advanced glaucoma. And that's really been my utilization of it at this point in time. We are planning on implementing in our clinic, and 100% the way we're going to do it is exactly how you just described it, Stephanie. Our bottleneck a lot of times with our glaucoma patients is that visual field. And so our plan is, when we have a new patient that comes in, let's say for a cataract evaluation that I happen to identify as a glaucoma suspect, or I'm concerned there is glaucoma, instead of having to get them up and out of the room and find a space in the visual field room, because I'm seeing other patients, I'm seeing glaucoma patients, maybe at the same time I'm doing a cataract evaluation. Well, I don't want to bring that patient back for that visual field. We'll be able to do the visual field in the room, order the Heru system, have them come in, technician will do it. We'll have a test very quickly, and that may encompass us bringing them back for a full glaucoma evaluation down the road, but we've had the ability to do that. I think the other way we're going to utilize it is for our glaucoma patients. We may have multiple glaucoma follow-ups or glaucoma evaluations set up, and that bottleneck of the visual field getting backed up, we're going to be able to put a patient in a pre-testing room or put a patient in an exam room and say, hey, we're going to do your visual field here. Again, no learning curve and looking at the printout. And I think it'll just make us much more efficient in that regards.
Yeah, absolutely. And you guys have such a huge practice and with so many doctors and so many patients. So time is of the essence, and having something like this to help with patient flow and efficiency is just, I think, going to be incredible. So thank you, Justin, so much for being with us today and sharing all your expert insights. And for all the attendees listening in, make sure you check out the Heru booth and learn more about their company and the technology and what they have to offer. Bye.